Okay, so today we're going to be talking about kidney disease. So what is kidney disease? Well, it's a gradual loss of your kidney's function over time. So the kidneys work to filter the blood. This is something that happens over time. It's usually secondary due to a primary issue. So an example would be hypertension would be the primary issue, or high blood pressure. And over time, it can progress and affect the kidneys, and then they can lose their function and cause kidney disease. How is it diagnosed? Well, there are a couple of different ways that you can diagnose kidney disease. One way is through blood tests, testing for serum urea levels, a test that's called the BUN and creatinine. These are just measuring like kidney function tests to see how they're doing. And then there's one called GFR. This stands for glomerular filtration rate, and this determines kidney function. In people who do not have kidney disease, their GFR will be above 60. For people with kidney disease, there are different stages, but anybody who has kidney disease has a GFR of 60 or less. And then when the disease progresses, a GFR less than 15 indicates kidney failure. There are also urine tests. One of these examples, or these urine tests look for what's called albumin, which can pass into the urine when the kidneys are damaged and cannot filter this out. You can do imaging to visualize the kidneys, or what's called a biopsy, where you take a sample of the kidney tissue in order to help determine the cause of the condition. So some risk factors. There's modifiable and non-modifiable risk factors. Modifiable risk factors are things that we can change in our day-to-day life. So some non-modifiable risk factors for kidney disease include age, generally over 60, gender, race. Chronic kidney disease or kidney disease in general is significantly higher for African Americans. The rate is about 4 times higher than those for Caucasian ethnicity. A family history of chronic kidney disease, otherwise known as CKD. And if you have a history of hypertension or cardiovascular disease, an example of this would be hypertension. Some non-modifiable risk factors would be the same thing, the cardiovascular disease, so that hypertension, because you can monitor that. Diabetes, and in individuals who smoke. So some things that we can do in regards to these modifiable risk factors, or things that we can change, would be to make sure to manage, for example, diabetes well with medications such as insulin or any oral medications you're supposed to take to manage diabetes, as well as diet, making sure to adhere to a diabetic diet. Reduce tobacco use or quit smoking. I know that this is commonly difficult for people to do, so some other steps that you could do to help limit, or if you need assistance in quitting, or if it's something you're looking into, you can always talk to your healthcare provider about, or otherwise known as like a GP, general practitioner, or a PCP, your primary care physician, and talk about ways to stop smoking, or to help you gradually quit. Some examples could be nicotine patches or any lifestyle modifications. So some treatment options for kidney disease. Treating the cause or any complications that come with kidney disease or that contribute to it can help. For example, hypertension or high blood pressure, you would want to give medications to help lower that blood pressure, or adhere to a diet to help regulate blood pressure and keep it within a normal range. Anemia, medications for that. Lower cholesterol, appropriate diet, lifestyle, medication changes to help combat that. In addition, follow-up testing routinely with your provider to make sure that you're monitoring your kidney function, so that if it progresses, you can be prepared for that and the next steps with that. And then it's progressing at a natural rate or a regular rate, something that you can monitor, or to make sure that it's not progressing, or things like that. Dialysis is another option, which is later in the disease progression. And this is just kind of like, because your kidneys act as a filter for your blood. So you use dialysis, which acts as somewhat of, a good way to explain it would be like a artificial kidney, so it filters your blood and then puts the fluid back. Or you can, in later disease progression as well, there's the option for kidney transplant. And then we have some diet modifications. So some diet modifications for patients with kidney disease include a low protein diet. And in order to check, you can always check food labels. However, the exception to this would be for patients who are on dialysis. They do need their dietary protein intake to be increased, whereas patients with kidney disease who are not on dialysis would need to lower their protein intake. Then we can increase fruits or intake of fruits, breads, grains, and vegetables. Some fruits to eat would be peaches, grapes, pears, apples, watermelon, berries, pineapple, and then fruits to limit or avoid would be cantaloupe, oranges, kiwis, raisins, or other dried fruits, bananas. And the reason for this is because the kidneys cannot filter off potassium, which is a mineral or an element. And so that's found in these fruits, and you would want to limit the intake of that because those are high in that potassium, and so we want to try and avoid that. Same thing goes for these fruits or these vegetables. We'd want to eat vegetables that aren't as high in the potassium and avoid some that are higher in potassium. So broccoli, carrots, cabbage, celery, green beans, peppers, zucchinis, those are all vegetables that you can eat. And then the ones you'd want to limit or avoid would be like cooked spinach, asparagus, avocado, potatoes, tomatoes. Monitor or limit fluid intake because you can, this is the kidneys have a difficult time filtering the blood. You can have a backup of fluid or too much fluid, which can cause problems. You would want to increase your iron intake to help prevent anemia, reduce or limit your salt intake, limit dairy because of the phosphorus levels in those. You want to help keep that low. So you want to limit milk, yogurt, cheese, and then stick to more monounsaturated or polyunsaturated fats. So for example, when you're cooking, instead of using like butter or lard, you can switch it to olive oil, canola oil, sunflower oil, stuff like that. Here are some references. Thank you.